this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about hydrocele. So let us first see what is the meaning of hydrocele. So a hydrocele is a collection of fluid within the processus vaginalis that produces swelling in the inguinal region or scrotum. So basically in hydrocele, there would be collection of peritoneal fluid, and that would, that accumulates in the scrotum through a small passage called processus vaginalis. Now this processus is actually a finger-like projection in the inguinal canal, and through this processus the testes descend. Well, so this is what we mean by the term hydrocele. Now next, moving on to the classification. So here we have majorly, two types, that is primary hydrocele and secondary hydrocele. Now what is primary hydrocele? So when there is no definitive cause, or we can say, it is idiopathic, in that case we call it as primary hydrocele. And the next one is secondary hydrocele. So when do we call it as secondary hydrocele? Now when there is disease of testis. So there are several diseases of testis which can actually cause secondary hydrocele. So for example, if there is TB of epididymis, or if there is testicular tumors, in that case also there might be the child might develop secondary hydrocele. Well, next, moving on to the etiologies of hydrocele. So here there can be two things. The first one is congenital, and there might be acquired, right? So in congenital hydrocele, what happens? So with the descent of the testes, the parietal peritoneum forms the processus vaginalis and the cavity of the tunica vaginalis of the testis, right? Now mostly the congenital hydrocele occurs when there is lack of closure of the processus vaginalis. So we have already learned that in this processus vaginalis there would be collection of the peritoneal fluid, right? So when we call it as congenital hydrocele, when there is failure of closure of this finger-like projection, which we call it as processus vaginalis, and when there will be accumulation of peritoneal fluid. And the next one is acquired. Now what happens here? So there is balance between the between fluid production and the outflow in the cavity of the tunica vaginalis. Now there are certain disorders or certain diseases which disturbs this balance, right? So if there is inflammation, if there is tumors or testicular trauma, or torsion of testes, all these things might can impair this balance, right? So because of that, if there is hydrocele, we call it as acquired hydrocele. Well, next, moving on to the types of hydrocele. Now here we have majorly two types, that is communicating hydrocele and non-communicating hydrocele. Now the first one, let us see what we mean by communicating hydrocele. So in communicating hydrocele, we can see a persistent communication with the abdominal cavity. Well, the next one is non-communicating hydrocele. Now here in non-communicating hydrocele, what we can see is that there won't be any persistent communication with the abdominal cavity, and also this results this occur as a result of increased fluid production or as a consequence of impaired absorption. So that means it is a kind of secondary hydrocele that we can say, right? Because here there is the balance between the production and the outflow is hampered, right? So for example, in older children, especially after a viral illness, we can see that sometimes they would be affected with scrotal hydrocele. Well, next, moving on to the symptoms. So what are the symptoms we can see in a child with hydrocele? Now the first thing would be palpable fullness. So this typically manifests, the hydrocele typically manifests as a soft, non-tender fullness within the hemiscrotum, right? So there would be a palpable fullness. Next thing would be transillumination. So when the scrotum is investigated with a focused beam of light, the scrotum would the scrotum transilluminates, and that would reveal a homogeneous glow without internal shadows. So this is one more feature that we can see in a child with hydrocele. Well, next, moving on to the diagnostic measures. So in diagnostic measures, the first thing that we would do would be physical examination, and then we can do ultrasound. Well, next, moving on to the management. So for management, actually the fluid in the hydrocele is usually reabsorbed before the infant reaches age 1 year. But if it does not get corrected by this age, then there might be need of surgical correction. Now there are certain factors which indicate that there is need of hydrocele repair, and there are certain factors which indicates that there is need of surgical repair. So the first thing is if there is failure to resolve by age 2 years, and then if there is continued discomfort, and if there is enlargement in volume, or if there is unsightly appearance. And sometimes the child might also get secondary infection due to this hydrocele, but it is very rare. But that is also a factor which is considered as which indicates that there is need of hydrocele repair. Well, there are three major surgical techniques which are followed for surgical correction of hydrocele. So the first one is inguinal approach. Now what they do in inguinal approach, so basically there would be the processus vaginalis. They would do ligation of the processus vaginalis in the internal jugular ring. And the next one is scrotal approach. So here in the scrotal approach, what they do, they would be, there is excision and eversion of suturing of the tunica vaginalis. So the next thing is sclerotherapy. So here in sclerotherapy, they do scrotal aspiration and also, sclerotherapy of the hemiscrotum. Well, next, moving on to the nursing management. So let us learn what are the nursing interventions that we should consider when there is a child with hydrocele, right? So the first would be health education. Now you have to educate the parents about the condition and how it can be treated, and what are the complications are there if it is not treated. What are the complications that might occur? You also have to make sure that you reduces the risk for infection. You also have to educate the parents on that. And then you have to monitor the fluid volume. So you have to monitor their intake output chart. You also have to, make sure that you maintain the skin integrity of the child. And apart from all these things, you also have to make sure that, you relieve the child from pain. Well, that's all about today's session. So let us conclude our today's topic here. So today we learned about hydrocele, which means that there would be, collection of peritoneal fluid in the processus vaginalis, right? And then we also learned how to classify it. So there are majorly two classification, that is the primary hydrocele and the secondary hydrocele, right? And then we learned what are the etiologies of hydrocele, what are the types of hydrocele, and we also learned that how to manage it, right? So I hope you have got a better insight about the topic. Thank you.